ranked higher than 20th in the world. Today you fall into nearly 30th in the world in terms of per capita real income. And this is not the kind of trend that you want to encourage. This is not a trend that you should feel comfortable about. This is a trend that should set off alarm bells, because it means you're falling behind the rest of the world. When we calculate, and even more distressing is this chart, which shows the growth rate. When we calculate the average growth rate from 1970 to 1985, and from 85 to 2000, and you might say, well, why did I make that break? Well, I took the first half of the period and the second half of the period to see what the growth rates were. And in 70 to 85, the average per capita growth rate was 1.27%. That is, that you were adding more than 1% every year to the real income that an average Bahamian could enjoy. That growth rate has fallen to almost 0.06 per year in the latter part of that period. So this is something, once again, that you should be concerned about. Because whether it's health care, whether it's education, whatever it is that you want to achieve for your population, you can't do it if you don't have the resources to do it. And this is coming from, got to come from economic growth. So the decline in policy quality is showing up in lower average incomes and lower growth rates. Apart from any other development, this is going to reduce the comparative health status of Bahamians. It's worth just resting on that point for a moment. That whatever else you do with your health policy, whatever you jigger around, the fact that you're less wealthy and you're getting less wealthier than other people in the world means that your health status, because wealth affects health, is going to deteriorate relative to the rest of the population. Now, why am I raising this and making such a, and berating you about it? And, you know, because I see that people are starting to get an attack of horizontal neurosis already. This is a virus that I take around. I seem I carry it in my handbag or something in my briefcase here, because when I go to lectures, people, you know, usually after about 10 minutes, there's a certain sort of glazing of the eyeball, you know, and then it goes from the eye, the mucosa of the eye into the muscles that hold the eyelids up, and different people cope with it in different ways, and I've been watching very carefully. You know, some people will sort of, you know, cover up one eye, oh, you know. And then they move over, and then they cover up the other one. Oh, and I can always hear them saying, you know, my God, how could anything so small weigh 400 pounds? You know, and so I've been watching. I mean, my children added one to that. They said, Dad, one part that you forgot was the end stage. And what is the end stage? Well, the end stage is that you get what is called the woodpecker syndrome. You know. and the head keeps wanting to drill holes in the table, or in the back of the head of the person in front of you. But anyway, so I've been watching for that. But so why am I belaboring this point? Well, ladies and gentlemen, as I'm going to show you later, the Blue Ribbon Panel, although it doesn't talk about this in any great detail, is proposing a new kind of tax in the Bahamas to pay for this healthcare system, and it's an income tax. And the income tax, I can tell you, is going to be I'm going to show you some data later on from Canada to drive home the point about what your future will be around this tax. Because at the moment, it's good, the taxes introduced will be small, but it will become the most significant tax that you pay in the Bahamas. And it is going to make it more difficult for you to attract human capital, because your young people don't have to stay here. You already know that. They don't have to stay here. They're not getting the kind of opportunities here in the Bahamas that they should get. And they're leaving. And they're going elsewhere to find their opportunities. They're going elsewhere where their human capital is more highly regarded. And this kind of tax will make that exodus even more profound. And of course, the other kind of capital, well, you already know about that. That if you try and tax that, and of course it's not proposed at this moment to tax it, but when I show you the figures from Canada, you will realize that pretty soon governments will be, and when I say pretty soon, I mean over the course of the next 10, 15 years, your governments will be scrambling to get their hands on more dough to finance what they're proposing. Okay, now let's look at the Canadian case. So that's background. You've got to be very careful about the choices you make about your healthcare policy, because it's going to come to dominate the whole quality of your policy, and you've got a problem. But now let's go and look at a real live world example about which we've got a lot of data and experience of what it is that the Blue Ribbon Panel Commission is actually suggesting. We are the only country in the OECD that has exclusively public sector single payer for health care. The Canadian system needs to be carefully studied before launching a plan, because it is the only real live example of what they're proposing. And what I'm going to show you is a set of measurements of the Canadian system, and these are among the measurements that caused the Canadian Supreme Court to rule that the provisions of the sort of system that we have were injurious to the health of Canadians and violated their constitutional rights. Now, you would have thought there would have been more attention paid to, I must say. You would have thought that there would have been at least passing mention made of that here in the Bahamas as you propose to go down the same path. Why would the Supreme Court, which, by the way, is redder than the hind end of a baboon going, the north end of a baboon going south, in terms of its general approach to the world, why would the Supreme Court have made such a ruling? And the reason is what I'm now going to show you. When you're talking about health care costs, you have to be very careful, particularly if you're comparing countries, to make an adjustment for the age of the population. Why do we have to do that? Well, because as you descend into old fartdom, as my son keeps telling me I'm doing, your body starts to break down, and you need more knees replaced, hips replaced, you need all that stuff. Your heart doesn't work properly, you need more medication. So it gets more, you get more expensive as you get older from the point of view of health. So if you're looking at a healthcare system such as the Bahamian healthcare system, which has very young population, you can't compare that to Great Britain or to Germany or to Italy without making an adjustment for the age of the population, right? And so that's what we do in all of our calculations. We age adjust them so that we don't fool ourselves into coming to conclusions which are simply a reflection of the demographics. And when we make those adjustments, we find that the Canadian healthcare system is amongst the industrialized nations of the world, other than Iceland. Iceland is really a special example, although it's an example you might want to look at because it's got a population round about the same as the Bahamas, round about the same. They have a universal healthcare system, just like the Bahamas. They have a slightly, the age of their population, I'm not sure. I think it's slightly, it's more like Canada than it is like the Bahamas. But there's the cost of their system. It's nearly 13%. That would be about 13% of their GDP. It's, in other words, about double the cost of the Bahamian system at the moment. About double of what you're paying here in the Bahamas at the moment. Canada is getting right up there. We're up at about 11% of but of the industrialized countries, the major countries with a major population and all those kind of things, we are the most expensive. We always say that, we're the most expensive industrialized nation because it's not clear that it's appropriate to compare something like Canada with Iceland. It's not appropriate, I think, to compare Iceland with almost anybody except maybe the Bahamas because of the size, you see, because it's a different kind of problem. Now here's this is what's been happening to the cost, inflation-adjusted provincial and territorial spending per person in Canada on health care. And I'm showing you this graph because there's enough money on it. Of people say that, oh, the reason why the Canadian healthcare system has got problems is because we're not spending enough money on it. Those terrible conservatives of whatever stripe, they are cutting back the money for the healthcare system. That's why we don't have good healthcare. Well, nothing could be further from the truth. It's, this is I mean, if you were looking at anything, if you're looking at the cost of your budget in your personal affairs, you would regard that as an alarming trend, and with good reason, because as I'm going to show you later on, there are some real issues associated with that. But first of all, let's now ask the question, are we getting the results that we're paying for in Canada? Here we have the most expensive in the industrialized world. Oh, and by the way, I got to go back.